morning. So I want to welcome you all here. This is the needs assessment, a community needs assessment by UMass Boston on aging in Newton. I'm Mignon Murray. I'm the director of older adult services for the city. And we were part of this project brought in UMass, and over the last year and a half, have been putting this project together. This is part of the larger project to do with the Cooper Center. So the Cooper Center for Active Living is going to be going on the same site where the senior center was at 345 Walnut Street. It's going up right now. It's 3 floors, 33,000 square feet. It's going to have a room like this one, but that is larger and has a raised stage and a commercial kitchen that's attached. A library, multiple lounge spaces on several floors, program rooms, an art room, a ceramics room, fitness studio, a game room, a raised walking track above a full gymnasium, and a deck to dive for. The deck runs across the whole front of the building on the 3rd floor and is just going to be wonderful community space for all of us. So we're excited to be part of that and to really understand what residents were thinking and what they want to see, what they think is working. So that's why this project came to be. But I also want to say, if you have a group that you would like to have a presentation about the needs assessment or about the Cooper Center, I'd be happy to come out and do that for your group. I have cards here. We'll put my contact information up as well. Again, I'm Mignon Murray. I'm the director of older adult services. So for a few housekeeping things, if you haven't already, consider writing your information on a registration sheet that's being passed around. If you'd like to ask the presenters a question, there were white index cards. Due to time constraints, if you could write your question, and we will try to do those at the end. And then if we don't get to them all, we can follow up if we have your information on the card. And for those of you on Zoom, if you type in your questions in the Q&A section, and we'll try to answer as many of them as we can. And we also have, for those on Zoom as well, we're going to put the link to the report. And we also have hard copies available here in the room, or if you're on Zoom, we're happy to mail one to you if you let us know, or we have them at 20 Hartford Street where our offices are right now. So I want to introduce Caitlin Coyle and Kathy Burns from UMass Boston, and they'll get us started.
Thank you, Mignon. Good evening, everybody. Can everyone hear me okay in the back? All right. If at any time my voice fades, please let me know and I will speak up. It's a pleasure to be here this evening to share with you what is a lot of information. If you've had a chance to look at the printed report in the back or looked at it online, you know that it's very comprehensive, very lengthy, and is full of a lot of really rich information. What we're going to share this evening is some of the high points of that report and share some of our thoughts on recommendations as it relates to the findings of this project. So before I start, I'll just sort of reintroduce myself. As Mignon has already told you, I'm Caitlin Coyle. I direct a research center at the University of Massachusetts Boston, the Gerontology Institute there. We've been around for about 12 years, and we've worked with about 80 cities and towns across Massachusetts, helping them in various ways, engaging their community about aging in place, essentially. I'm here tonight with Kathy Burns, my colleague and right-hand person on this project, and we'll be sharing, like I said, sort of some of the highlights. I want to just do some acknowledgements before we get totally started into the material. Obviously, we would not be here without the support of the city, and specifically the Mayor Fuller, Mignon Murray, and Joan Belle-Isle, who were instrumental in leading us on this long journey and trusting us and really sort of guiding the ship. And so we couldn't have done this without them. And also just want to thank all of the people who participated. Hopefully some of you in the audience maybe remember completing a survey or coming to an event to hear about the project. And the results that I'm here to share with you this evening are only as good as the responses we got. And we got really wonderful and full responses from the city of Newton. And so I think you can be really proud of how people showed up when they were asked about aging in Newton. So just to recap some of the reason, why we got started. Mignon put it in context with respect to the Cooper Center. We also just have this sort of general understanding that people have a desire to age in place. They have a desire to age in Newton. We know that older adults, as we define them here in the US as people 60 and over, is a large population, a large segment of the city's population, and is expected to continue to grow. And that group, if we think about 60 plus, that's a lot of generations within that age bracket. When we think about 60 plus, a lot of different life experiences, a lot of different preferences and needs. And we know that when we think about older adults, what they want and need, that's an evolving conversation. And so this project was really in part to reconnect with the community and hear about what do you want? What do you like to do? What do you need? What are the kinds of things going on for you, so that the Cooper Center can be there and sort of meet those needs sorry, I'm getting distracted by the screen over here. In any case, those were some of our rationales. So that led us to this needs assessment. It's meant to both inform the city of Newton as it specifically relates to the future of programming and services at the Cooper Center, but also it supports the city in its ongoing efforts to be an age and dementia-friendly community. So being a place that is considerate of people and their aging experiences of all types. And also to inform other city departments about the strengths about living in Newton and the challenges being faced by older adults in this community. Really recognizing, and this was part of our approach the whole time, which is aging doesn't just happen at the senior center. It's not only relevant when we talk about the senior center or the Cooper Center. It affects all aspects of life. And so this is an opportunity to share information with the city more broadly about the experiences of people in the city of Newton. So what did we do? We did a demographic profile, which was based on American Community Survey data, which is a product of the Census Bureau. It's a sort of more detailed representative sample that's done every year between the decennial census. So we have that really looking at who lives in Newton across all age groups. We did a handful of key informant interviews with people who have either power, decision-making power in the city, or have a particular vantage point on what the needs of the community are from their positions. We also did 5 focus groups that were predominantly with residents, including a Chinese-speaking focus group and a Russian-speaking focus group, as well as a community stakeholder focus group. One of the challenges with this work, as you might imagine, is that we're hearing from people who are willing to be heard from. And we know there are people in the community who aren't going to respond to a survey. They're not coming to a focus group. They're probably not coming to the Cooper Center, but it's important to understand what their experience is like. And so we do what we think is the next best thing to hearing from them directly is to hear from people who work with or on behalf of them. So we think about faith community leaders, we think about direct care workers, people who are out in the homes and in the lives of people who might be more isolated. So that was another focus group where we tried to really hear about that experience. And then with the survey, which was sort of the main event in a lot of ways, we did mail that survey. We mailed a postcard notifying people of their invitation to participate in the survey. It was followed by a printed survey. We did it for a random sample of residents, 5,000 residents, age 60 and over in the city of Newton, but it was also made available online and was shared widely. And so anybody could take the survey, and we ended up receiving 2,869 responses. Which if we think about that in our context of the sample of 5,000, it's a 57% response rate, which is pretty incredible. It also represents about 10% of the total population 60 plus in Newton. So when we think about the results that I'm going to share with you, it is a good chunk of your community. And it's really just something to keep in mind as we go forward, that this isn't just a couple hundred people who responded to a survey that we put out. This is pretty comprehensive in terms of the voices that we documented. So a little bit more about who we did hear from. This is a table comparing the survey responses to the census numbers, age distribution. So one of the things we try to understand is, did we hear from a representative group of people in Newton? And so this is comparing on age. So you can see that, for example, our survey is underrepresented when it comes to people 60 to 69. So of our survey respondents, 34% of them were in this age bracket. That's compared to 47% of the actual population proportion of 60 plus in that age group. We did pretty well with respect to people in their 70s and 80s. And we had a couple people who did not tell us how old they were, which is fine. But anyway, so I guess the large piece of that is, as we go through this results, to kind of keep that in mind, that I will show some things by age category, and you'll see a lot of age breakdown in the report. So when it comes to age representation of the city more broadly, it is slightly underrepresentative of people in their 60s. So that sort of younger age group. We did have 33% male and 67% female, which is on par both with what we know about survey methodology, which is women are more likely to complete surveys, but also pretty on par with respect to the gender distribution of older adults in Newton. So we asked people about how long they've lived in the city and how important it is for them to stay here. So really wanting to understand what are people's feelings and sort of desires about aging in Newton at all. And so the pie chart you see is the duration for which people have lived in Newton. So we have about more than half of the survey respondents who've been here for 35 years or longer, so long time. But we also have 12% of people who've been here for fewer than 15 years, some even less than 5 years. I'm getting a notification that I don't want to join the audio, I don't think. Okay. Right. So majority of the respondents are people who've been here for 35 years or longer, so long periods of time. We do have a smaller group, 12% of people who've been here for fewer than 14 years. So in terms of their perspective, it's potentially skewed towards people who've been here for long periods of time. We asked how important is it to you to remain living in Newton as you get older, and I'm showing you this by age. And what you can see here is that for people in their 60s, 47% say it's very important. And the other half-ish say that it's only slightly or somewhat important for them to stay, and that changes a little bit as we get older. So in the 70 to 79-year-old group, 64% say it's very important for them to stay in Newton. And among folks 80 plus, 71% say it's very important for them to stay in Newton. So older adults, with age comes really sort of a placing importance on being able to stay in Newton. So this is some age projections, some age distribution of the city of Newton, looking back to the 2000 decennial census, showing you the 2010 and 2020 decennial census, and then sharing some projections for what the population is expected to look like in Newton, both in 2025 and 2035. And so what you can see is that comparatively, you sort of see steady growth between the 2000 and 2020 decennial census with respect to the size of the older adult population. So in 2020, the decennial census had 26% of the community age 60 and older. That's projected to grow to 28% in 2025 and 30% by 2035. So by 2035, it's expected that 30% of the community will be what we here in the United States consider an older adult. I wanted to share these are quotes directly from residents of Newton who wrote in. We asked about the things that people value about living in the city of Newton. We had thousands of, almost 95% of our survey respondents wrote something in. We reviewed all of those write-ins. We categorized them by topic. And this is what I'm showing you are the top 3. And so the top 3 things that people value about living in Newton are in the yellow box in the center of the slide, based on the frequency with which they were mentioned. And then the blue boxes are quotes that people wrote in their own words. So the number 1 thing people value about living in Newton is the location and the access to outdoors and amenities. So really people like being here. They like the location, they like having things nearby, they like being able to access the outdoors. And so it was really about this sort of the place of Newton that people value. Number 2 was they value the people and their access to friends and family in Newton. So that's sort of number 2. And number 3, people really value the safety of Newton and the city infrastructure in terms of things that when they think about aging in Newton, these are things that are keeping them here, that they value. And you can see the way that people described some of those things in the quotes. We also asked people about what are the things that concern them about being able to stay in Newton, and the same process was taken where we reviewed all of the responses, we categorized them by topic area. What I'm showing you here are the top 3 by way of frequency. Number 1, probably not surprising to many of you, is cost of living, specifically the affordability and taxes was the number 1 concern for people to be able to stay in Newton. Number two was the lack of downsizing options and the need for home maintenance. So people are thinking about where are they going to live, and they're saying there isn't a lot of options, so I'm going to have to stay where I am, and that's going to require some modification or some repair of my current home to be able to stay safely. And number three was this notion of maintaining mobility. And we heard about this in a couple different ways. One being about physical mobility, people being concerned about losing their physical mobility and how that's going to impact their ability to get around, but it also included transportation in terms of people being able to get around Newton either under their own power or with transportation support. And so that was number three in terms of the things that people were most concerned about. So going back to that the economic security piece, which was number one in terms of concern about being able to stay in Newton, this is census data that shows you the median household income based on 2022 dollars. And this is comparing people 65 and older to people 45 to 64. And what you can see is that there's a lot more socioeconomic diversity in the 65 plus group. So we just have a wider distribution in terms of where people are. And also that 24% of people are living under less than $50,000 a year in terms of their income in Newton. This is income, this is not wealth, so it doesn't account for assets and things like that. And I think part of this story is you would assume people 65 plus compared to people 45 to 64, well, they're retired, so therefore they're not working. So that makes some sense that they would have lower median household incomes. But I also think it speaks to just the fact that they're that very thing, this is fixed. This isn't changing in terms of as they age, this income isn't changing, whereas people who are in the workforce do experience that fluctuation. Among our survey respondents, we asked them to self-assess. Do you think you have what you need to meet your basic financial needs, including things like food, home maintenance, and personal health care? 10% of the survey respondents, 177 people, said no, they do not have the financial means to meet their basic needs. So that might seem like a small group of people, but when we talk about the sort of acuity of that situation in terms of people not being able to afford food and healthcare and things like that, it's pretty concerning in terms of what their needs might be. We also looked at how much people spend on their housing. So this is from the American Community Survey. This is the percentage of older adults who are spending 30% or more of their monthly income on housing. So when we look at householders who are renting their home, they have over half of them are spending more than 30% of their monthly income on housing. So we think of that as sort of housing cost burdened. You know, if you're spending more than 30% of your monthly income on housing, it means you don't necessarily have enough left over for your daily expenses. And so thinking about this group is particularly vulnerable. And so this is more common among renters compared to homeowners, although owners in Newton, 30% of them report being sort of burdened by their housing costs. So in the survey, we asked about food security, and we looked at this in the whole sample, and it didn't necessarily account to being anything too significant. But when we looked at this question for those 177 people who said they don't have what they need to pay for basic expenses, we see that 27% of them say that either often or sometimes they worry about running out of food before they have money to buy more. So again, it feels like a small group of people, but a pretty significant level of need. When it comes to housing, we asked a bunch of questions. What I'm showing you here are two questions about the need for home repairs and home modifications. So asking people, does your current home need a home repair in order for you to live safely for the next 5 years? And 39% of survey respondents said, yes, my home does need a repair. Of them, 30% say that they can afford to make that repair. And 9% say, no, I can't. I need that repair and I can't afford to make that repair. Similar pattern emerged when it comes to home modification. So I think of these as less sort of acute responses. So putting in a ramp or grab bars, sort of more modifying your home as opposed to a repair, which is I think the examples we gave where I need a new heating system or a new roof. So people who need modifications to their home, 36% of our survey respondents said, yes, my home needs a modification in order for me to be able to live safely for the next 5 years. Similarly, 31% say, yes, I need this and I can afford it. And 5% say, I need it and I cannot afford it. And so this is interesting to me for a couple of reasons. One, I think 39 and 36% is a kind of a lot when it comes to people thinking about their needing this kind of home improvement. But also that such a large share of people who say they need it also can afford to make it. So the question is then, well, why aren't you making it? Or why haven't you made it? Or why do you need it if you have the funding? And I think it just, for me, it speaks to the complexity of that situation, you know, in terms of finding somebody to do the work, coordinating that project, managing that project, all of those things that come with living through a project like that. It's a lot more complicated than just, I need it and I have the money. So I think that's a place to think about additional supports. We asked about what kind of housing people would like so we had to sort of prompt them. We sort of assume that everybody wants to stay in their current home. So we prompted them by saying, if you had to move in the next 5 years, what kind of housing would you like? And this is by age group. And so what you can see is that for the younger side of the age brackets, people in their 60s and 70s, they're most interested in condominiums or townhomes. And also smaller single family living. For people in their 80s, they are most interested in assisted living community. So not super surprising, but just sort of that interest in independence. People want independent living. They want either a condo or townhome. They want a smaller single family home. And then when we talk about the 80 plus, they're more interested in housing with supports. Transportation, we asked about people's driving status. So we asked, do you currently drive at all? And if you do you limit your driving in some way, knowing that some people stop driving at night or they stop driving out of town just to feel safer? And so this area graph that you see here shows that by age group. And what I think is interesting here is that starting in the 70s, so you've got 27% of people, 22% of people who say I modify my driving, and an additional 5% of people say I don't drive at all in Newton, people in their 70s. When it comes to people in their 80s, that jumps up to being 29% of people modify their driving in some way and 18% do not drive at all. So when we think about the transportation needs of older people in Newton, I think two things come to mind. One, just sort of this nuance of people who, you know, they may not be in dire need of transportation because they don't drive at all, but they may be wanting to modify their driving in some ways, or they're already doing that and they need ways to support themselves in getting around. And also with age comes more non-drivers. So just thinking about the targeted resource, you know, sort of what are the transportation options and how can they be sort of targeted? We asked about whether people had to miss or cancel or reschedule a medical appointment in the last year because of a lack of transportation. And when you look at people who drive with no limitations, that was only true for about 2%. That jumps to 30% of people who don't drive at all. So 30% of non-drivers did have to miss or cancel or reschedule a medical appointment because of transportation, and 9% of people who are modifying their driving had this experience. We asked some questions about just the physical outdoor spaces and sort of built environment of Newton. And we asked about people's levels of satisfaction with various sort of age-friendly features. And what I'm showing you are actually the levels of dissatisfaction with those things, and just kind of highlighting the top 3 things that people are most dissatisfied with in Newton. Number 1 being conveniently located restrooms. Number 2, lighting along sidewalks. And number 3, availability of benches or shaded seating in green spaces, sort of parks and along paths. So this is just interesting to think about when we're talking about aging in a community and what makes people, what satisfies people as far as being able to physically get around, that these are really about accessibility, right? And comfort, and sort of knowing that if I go out in the community, I'm going to be able to find a bathroom or a place to sit. And that makes me feel more inclined potentially to participate in the community. We asked about caregiving, and we heard this is about whether you've provided care or assistance to somebody who is frail or disabled in the past 5 years. And you see that across all ages, about 37% of people said yes, but that is highest among people in their 60s. So 45% of people in their 60s are providing care. or have provided care in recent years to someone. The reasons for needing to provide care, we also asked them about what kind of condition required care. Number one was mobility impairment. Number two, which was pretty surprising to me, is psychological conditions such as anxiety or depression. So 21% of caregivers say that they're providing care to someone who is struggling with a psychological condition. And then 17% of caregivers are providing care for somebody who has chronic disease or Alzheimer's and dementia. So again, thinking about this as a segment of the population that may or may not be coming to the Cooper Center. And if they're not, thinking about, well, what are they dealing with and how can they be supported? We also asked about how that caregiving sort of affected their life. And we see that 21, we asked about their physical health, their mental health, their social life, and their financial circumstances. The highest social life was affected the most. So 21% of caregivers said that my social life has deteriorated as a result of my caregiving. So speaking just to one of the many aspects of sort of social isolation and loneliness, thinking about the version of that is attached to providing intense levels of care to someone. Speaking of isolation, we also asked some questions about sort of frequency of social contact. This is comparing the kind of social contact, so talking on the phone, sending an email, or using social media, or getting together in person. One of the takeaways for me here is that 10% of the population, of the sample of the respondents, say that they only get together in person with someone once a month or less. And so that when, obviously I think part of that is a product of COVID that we're still kind of coming back from, but I just think that that's when we think about isolation and the risk for it, again, that 10% is something to watch. We asked about, do you know someone living in 30 minutes of your home on whom you could rely for help if you needed it? 10% also said, no, I don't know someone. And so if they don't know someone there, likely they're calling 911 or perhaps the center, they're looking for support if they need it from somewhere outside of their own social network. We also asked about local policymakers and whether or not people feel like they're being heard. And majority of people said that they agree that local policymakers consider the interests and concerns of older residents. 26% say they disagree or strongly disagree. And then 16% say they don't know. They don't have an opinion on the topic. All right, so the Cooper Center. So at the time of the survey, we were not calling it the Cooper Center yet. So I apologize ahead of time for using the wrong, I was struggling whether I use the language of the survey or the language that's being used now. In any case, so I'm gonna likely refer to the Senior Center because that's what we referred to on the survey, but I recognize the change in language as a result of that. We asked about people's participation by age, which is what you see on the line graph. And what you see is steady increase in participation rates with age. So 20% of people in their 60s said, yes, I have participated at the Senior Center. And that jumps to 42%, and then 45% of people in their 80s who said, yes, I've participated there. Of people who participated at the Senior Center, we asked them how frequently they participate. And there is where we see that 70% of users only come a few times a year for special events. So of the users, a number of them are coming just for a one-off thing here and there. And then you see some distribution of people who come more regularly in terms of a couple times a week, etc. So I don't think there's anything good or bad about this. It's simply interesting to me to think about people's different relationships with the center and expecting that as we think about the Cooper Center, that it's likely that similar patterns will emerge where there are people who come regularly and there are others who come in and out, and just what that means for the community and this space. We did ask people, what is the likelihood that you or someone in your household will use the new Cooper Center? And we did this by people who said, I've already been to the Senior Center versus people who said I've never been, just to see what that looked like. So people who said, yes, I go to the Senior Center, 79% of them said, and I will be very likely or somewhat likely to attend the Cooper Center. Of people who said they've never been to the Senior Center, 43% of them said, I or someone in my household are very likely or somewhat likely to attend the Cooper Center. So I think this gives us a little bit of a window into this idea that people who've not had a relationship with the Senior Center, the Cooper Center, are potentially looking forward to participating at the new space. And we also asked about what limits people's participation at the Senior Center. And we did this also looking at users versus non-users, and the sort of most popular kinds of things are people saying they don't need the services offered or that they're still working. And so there's this sort of sense that people don't, for me, there was an ongoing theme of people sort of feeling like that you need to have a need to use the senior center. You have to be in need to go to the center, that came up in a few different places. We also asked about what kinds of services, specifically services, people would like to prioritize in expanding. And again, looking at users and non-users to try to understand, well, what are people who've never been, what are they looking for versus people who have come to the senior center. And we see that for similar patterns for both emerged, but really the top services that people are looking for: transportation to medical appointments, in-home programs, and information and referral to services. So people are looking for things to come to them is how I sort of think about those needs and preferences for services. But you can also see that there's fairly strong support for things like support groups and transportation for errands, etc. When it comes to programs and what programs people want, indoor and outdoor fitness were among the top preferences, which is, we've got beautiful gym space and track walking to be done. People are also really interested in performances and presentations and educational opportunities. So people want to be physically active and they want to be intellectually active across both users and non-users. Also, what I found to be kind of interesting is that in the top 5 is volunteer opportunities, and that's particularly high among non-attendees. So people who've not been to the senior center are really looking for volunteer opportunities. And so thinking about what that means for the future of the Cooper Center. Lastly, we ask about communication and information. We ask about where do you get your information, or where do you prefer to find information? It's interesting, we do this work in lots of communities, and no matter how big the city or small the town, knowing what's going on is always a challenge for people. It's an ongoing challenge. And so we wanted to get a sense. So this is looking at it by age. And you see that for people for the younger group, for people in their 60s and 70s, email, particularly the mayor's update and sort of email newsletters, is the most preferred way to get information. And that when we look at people in their 80s, that they're looking at the Newton Senior Center, the newsletter that is produced by the Cooper Center. I was going to say something about word of mouth is something that actually was sort of evenly popular across ages. So we think oftentimes about communication and media, we think, oh, younger people are more likely to use social media and email, and older people are not. But I think the thing I think is interesting is that word of mouth is sort of universal when it comes to a surefire way to get the word out. So we have just a few minutes, Kathy, to share some recommendations with the group so that we have a few moments for questions. So Kathy is going to share some of the recommendations. I will just preface that conversation with the fact that these are not prescriptive, they're not must-do things. They are ideas, they are suggestions based on our knowledge and expertise and the data that we uncovered here in Newton. The Council on Aging and Mignon and her people have lots of ideas and lots of things that are already in the works that will come from this data. So this is not comprehensive. Take it away, Kathy.
Well, can you hear me?
No, like this.
No.
Hold it like an ice cream cone.
Like an ice cream?
There you go.
Is that it?
Yeah.
Yes, you can tell I don't do this very often. I wanted just to start by saying that I was fortunate enough to be able to do a lot of work with Newton residents and leaders through the focus groups and the what we call key informant interviews. And one of the things that's in the report is a section that talks about those experiences, and it's full of wonderful quotes and really interesting, I think, information. I am always impressed with people who participate, and in particularly in Newton, probably not surprising to all of you, it's an incredibly invested community, and it was a pleasure to do the work here. So let me just start by saying that considering the size and diversity of experiences among residents 60 plus, you've got an opportunity and also a challenge for the new Cooper Center for Active Living. And one of the things that's really going to be important is the outreach, the marketing, the programming, and getting it right over time. It will all unfold in the by and by, and it's going to really depend on people providing input and getting involved. So the other thing that's important is that the size of this building is going to really require an increase in the volume of staff, and there's going to be inevitably more people and requests for services. So let's just start with the suggestions around expanding program offerings and hours of operation. That's already, in the works. There will need to be evening and weekend hours to really accommodate a lot of people who want to be involved and who work or have other involvement during the week and during the day. So Caitlin already said that people are looking for fitness, performances, presentations, educational programs, stuff that they get in-home, and also outdoor activities. So I want to say that we, because there was a real interest on Mignon's part to really find out more about people who live alone, who are growing older alone. We call those solos. You may be one of those people, or you may be learning more about that fairly large cohort in Newton and in the United States. So we did some special conversations with people who are solo agers and people who are newly retired or semi-retired. And it's really, it was a fascinating conversation. And these are people, when I say people want more social activity and interaction along with presentations and learning, that doesn't really say anything new about anybody who's older and what they're looking for. But these are people who are really looking to do that with their own age cohort, so to speak. So it was really an important and interesting conversation around that. Let's talk about increased awareness of the programs and services. We feel like we really know that welcoming people is already part of the aim of the senior center, but it's really, really going to be super, super important. And I think the older we get, there is still a sense of coming into a new situation and feeling like, who's going to talk to me? Or what am I supposed to do? So we never grow too old to have that experience. So it's going to be really important at the Cooper Center. So, things like offering an introduction, giving tours, targeting the activities and the information to different age cohorts or people who are in different circumstances is going to be more important than ever. Some people who, for example, are not yet retired may be interested in retirement planning. They might be interested in really learning more about Medicare and what they're supposed to do. Some of those things exist, but to really kind of ramp up that stuff is going to be particularly important. We already mentioned that caregiving was a big issue, and Caitlin pointed out that it's that age group, which we call the sandwich generation, that really is struggling. These are people in their 60s and early 70s who have children and also have older parents. And so whatever can be done, and there's already stuff happening, but we list a few things that we think are going to be really possibilities and important to support the people who are doing that often difficult work. And I also say, the interesting thing about one of the populations needing services are people who are living with mental illness. And so, I hope that the Cooper Center will get really involved in other services that are out there through Newton Wellesley or through NAMI to really help support those individuals and their caregivers. Maintaining independence, of course, is a major concern, and transportation is a key facilitator to that. Many people are dependent on their car, and they worry about what's going to happen if they can't drive. So a third of the respondents happily report doing walking and biking as their primary mode of transportation. 24% rely on the MBTA and buses. But as we said, a significant portion of particularly the older population, the oldest population, don't drive or don't or drive, with limitations. And this is a big concern. And so anything we can do to support additional transportation options. We now have GoGo, and I know there's a lot of effort being made to adapt that to respond as it's unfolding. So we'll continue to evaluate that and make changes so that people have options for getting around and that aren't super expensive. There are I don't know if I put it up there, but how to retire from driving educational programs are kind of important things to help normalize the experience that many of us have or are going to have around driving or not driving. We said that the number one concern about aging in Newton is financial security, with a specific focus on being able to afford housing related expenses, and of course, being able to downsize and the affordability of renting and all of that. These are huge problems that exist everywhere. So we do not pretend to have answers for that, but we do look at some of the more low-hanging fruit kinds of recommendations. And so a lot of that has to do with education and really making a concerted effort to help people have conversations about housing, about the cost of things, how to take advantage of the programs that exist on tax benefits and those kinds of things that exist already in Newton. So a lot of that is going to be important. We talked with the chamber. They they were talking about the issue of employment, and many people are looking for employment after retirement. And so, buddying up with the chamber to do some work there, I think will be important. Housing maintenance, we talked about that as being a problem. 46% of our respondents said that they needed repairs. This is a condition that's happening in every community, and people are always looking for assistance. You get into knotty kinds of situations when you provide assistance that's not vetted, or there's lots of liability issues, but certainly there can be an effort to create a resource for people to where do I go to find a reputable person. So more resources. A lot of people are looking for the Cooper Center, the Senior Center, to be a link to all kinds of information. And, it can be a hub where people use the services and then they take them out, or they find out about something. For example, the solos were really interested. Where can I go outside where I'm going to find people in their 50s, 60s, 70s that I can hang out with? Maybe we can have folk dancing on Saturday nights at the Cooper Center, that kind of thing. So maybe we could develop a fund to help people who need support in making home modifications or to their homes or their apartments or whatever. That's another. Lastly, I spoke about solo agers, and 39%, what did I write here? 22% of the people here in Newton are 65 and older, live alone. And that's even higher for those who are 80 plus, that's 39%. So as we can continue to explore issues of connection, of how to, sort of mitigate against loneliness and isolation, it's going to be important to consider the ways in which we can foster connection. And so we are already a age-friendly and dementia-friendly city in Newton. And so we have the opportunity to really dive into that and work together with the city and the various departments in the city to promote opportunities for people to meet. You mentioned the benches. one person said to me, or a couple people said to me, don't make them metal. It's too cold to sit on them. So, there's lots of meaty things that can be done. The bathroom situation is another thing. I know at one point in Brookline, they had something, where to go when you have to go. So, and it was a resource that kept getting updated, a valuable one. And the sidewalks, hopefully, the Department of Transportation can be an ally in looking at the ways to improve lighting on the sidewalks. So the other thing that I want to say is that the issue of scams came up a lot. And I know that the police are really concerned about that. And oh, I'm sorry. Wow.
What a difference.
What a difference. I hope all the important things I say didn't get missed. Anyway, scams. I was just gonna say around that issue. It's a big issue, and I know the police department is really eager to work with the Cooper Center around that. So there you go.
So with that, we'll say thank you for listening to all of that information. I know we have a few minutes for questions. I know Batia, you're gonna. Okay. Okay, great. If you have an index card with a question on it, raise it up and we'll come around and collect those. And if you're on Zoom and you have a question, you can put it in the chat or the Q&A.
It looks like we have 32 Q&A, but a lot of that might be pretty much.
I see.
Anybody who's gonna get a card that wants to raise their hand? They did. They mentioned it.
Batia, are there ones you want to start with on Zoom?
So we have one question is, what is the demographic of the senior population of Newton? What physical church or worship buildings are located in?
Yeah, so the question, I can repeat it. The question is, what is the demographic of the senior population of Newton? What physical church or worship buildings are located in Newton? So with respect to the demographic of the senior population, I'm assuming you're referring to the size of that population, which at the 2020 decennial census was about 23,000 people age 60 and older. And as far as the physical church or worship buildings, I'm sure there are numerous. So we can maybe get that person some information about faith communities. And then what are the most common scams in Newton? I wish I could say that there were common scams. I think they're being enumerated at rates we can't keep up with. But I don't know if there's been any recent popular ones. Someone is asking, why wasn't the condition of sidewalks included as a question in the survey? Because sidewalk conditions are very dangerous for the elderly, including the tree root systems, which create those sort of cracks, etc.
They were, I
believe it was an option to
Just
tell us about sidewalks. It just didn't necessarily rise to the topic. Kathy's going to check that for me.
just so you know that part of this in the back is an appendix. Hello, in the back is an appendix with every single question that you can take a look at, and the answers are provided by age cohort.
that.
So did you find that?
Yeah.
Oh, I think I do believe we asked.
Oops. Yeah, we asked about the handicap accessibility of walkways. And 57% of people said they were satisfied, but 33% said they don't know the answer to that question. We asked about the availability of sidewalks, so whether they are available at rates that are satisfactory. And almost 80% said that they were satisfied with the availability of sidewalks. So sidewalks are
Another sidewalk. So take note, sidewalks, so.
More sidewalk.
Are there plans to expand the Shine program?
So we actually have a very expansive Shine program, but there will never, ever be enough Shine appointments, especially during open enrollment. We're fortunate that we have, I believe, 7 Shine counselors, that are assigned to us, from the city, which is, exceptionally large compared to most communities. But in the Cooper Center, we are fortunate that there are 2 offices that are really going to be spaces where those counselors can work. And, that won't be interrupted with other programs or having to move offices, that there are 2 that, will be primarily just for Shine appointments. So hopefully, given that and the, additional hours that the building may be open, hopefully we can expand and have additional counselors.
What is Shine?
Shine, serving the health information needs of everyone. It's a phenomenal program that is, Shine counselors are trained by, I don't know, the state or if it's by different cohorts. Caitlin might know.
It's a federal program that the state manages.
Want to give Shine?
Sure. Shine is a federal program that the state manages here in Massachusetts, but it's a federally developed training to educate volunteers about Medicare, Medicaid, and health insurance ins and outs, and so that they can do some peer counseling with people. They meet with them to sort of go over their circumstances and recommend what health insurance is going to be the best option for them. Fantastic program. Other questions?
Yes. On Zoom, we have, did you ask about race? If so, how did your responses compare to city statistics? How did you decide to single out Chinese and Russian speaking for focus groups?
Good questions. As far as the Chinese and Russian groups, I think those were largely based on sort of what we know about the size of those populations of older adults in the city. And I'm trying to find we asked about country of origin, sort of whether people were born in the United States or not. So we have 85% of our survey respondents who said that they were born in the United States and 15% said they were born outside of the United States. So we didn't ask directly about race, but we did ask about their country of origin.
I should note that there were over 70 countries represented in country of origin, so there's a lot of diversity in that origin piece. Someone said, how will these findings in terms of the focus groups with Russians and Chinese speaking people, older people, how will they be applied to the new senior center? I don't know, but that's up to Mignon and her crew. But I do know that a couple people in the Chinese focus group, as an example, volunteered to come and do programming at the center. So I think the idea of champions who can come and work with Mignon and her crew to offer programming in different languages and to different ethnic groups will be really an important piece of the pie. A lot of the Chinese speaking people were people who were in their 60s and early 70s who had professional careers that they would like to use here and to develop programming that they can run classes at the senior center.
So in tying in with that, there's also a question about programs with youth. Are there any thoughts on about collaborating with teens and children interacting with seniors in Newton? So I would say again, as Kathy's saying, we want the Cooper Center to be as inclusive as possible. So if there are individuals in the community or groups that want to speak to us about ideas they have or programs they'd like to see or vendors that they know are available, we are really welcoming and happy to talk to anyone with those ideas, and please reach out. We'd love to hear your thoughts. I'll go through a couple that I have here, Kathy. What about parking near the Cooper Center? Doesn't matter where you are and what community, there will never be enough parking anywhere. But parking near the Cooper Center will be better than it was when the old center was there. The old center had, I believe, very, very, very limited parking. The new center will have 31 spaces. It's not a ton, it is more than we had. And there's also the Austin Street lot, which I think people often don't know is public parking. It kind of runs underneath housing that's right by Cafe Nero and Starbucks there. That is accessible, it's public parking. I park there every Tuesday morning when I go to the Cooper Center for construction meetings. It's, again, we'll never have enough, but I think we're gonna have better adequate parking than one would assume. I think it will be easier than we think it will be. Let's see. What is the role and what should be the role of our Newton Library in regards to seniors? Jill Mercurio, the director of the library, and we talk often. My program staff talks often with the program staff at the library. We would love to collaborate as much as we can. We've been speaking to them about our library or reading room that we have at Cooper. So we'll, continue that work. And again, any ideas, we're happy to hear. Acknowledge we've had no senior center for 3 to 4 years. So it's been over 2 years now since the crew moved out of the old senior center. So we are temporarily located at Brigham House, which is in Newton Highlands at 20 Hartford Street. There's limited program space there. Most of the staff is based there. We're also using the Hyde Gym, which is across the street at 90 Lincoln Street. So we have most of our fitness classes there. We have some of our discussion groups and things of that nature. We also use this space for concerts, the Drucker Auditorium, the library. We've used space over at City Hall. We have been without, being able to be all together. But very shortly now, we will all be back together and have phenomenal space. So it has been challenging. There was COVID and then there was moving out of that building, and it's been a long time since we've had a great spot for people to go. And we look forward, as I'm sure you do, of having that. Let's see, you guys have any more?
Somebody just says, please go to the Attorney General's office website to report scams. We can have them come out to provide a presentation to the community. So do that. Dealing with taxes, yes, we know. Newton has assessments going up dramatically. If a McMansion gets built next to your old house, in some states, assessments are frozen at 70 or 8 or 75. No one has spoken of that. And I know it's an issue that is not spoken about here, but it's being spoken about at the city level. Anything else there?
We have a really good question from one of our attendees on Zoom. It would be great to offer a help service where people could ask for help with certain small tasks. Volunteers from the Cooper Center, schools, faith communities could provide these.
So do you want to speak about Friendship Works podcast?
So we actually, the Cooper Center does offer these services through a partnership with a program called Friendship Works. Anyone who is living in Newton C plus can actually apply for these services. The services is called Friendly Helping. They can also apply for another service called Friendly Visiting. So if you are looking to make friends, this is a great way to do it. Also, for those of you who are asking about volunteering, Friendship Works is also recruiting volunteers right now for their Friendly Visiting, Friendly Helping, and medical escort services. So if you are interested in that information, we can certainly provide it. Oh, and I think one of our computers, battery, talked about technology.
It's 8:01, so it was
We've
like,
talked too long.
that's right. It was just cutting us off.
This is the important one that we are sharing
Great.
right now. Sorry, this computer is also a little slower than anticipated. Is there a possibility of creating a program like the Cambridge HILR to create an active and dynamic teaching and continued learning community?
I'm unfamiliar with.
I
it.
am also familiar.
Yeah, unfortunately, we're not
Harvard.
familiar with that. We're happy to, look further into it.
Connecting with formal higher education institutes for,
There's Ollie and
yep,
Bali and.
yes.
Someone else posted, how can we convince the city councilors to allow drive-through restaurants in the city?
Good luck with that.
Good luck. We have a question, can you please explain the Dementia Friends Massachusetts program? How can that help those seniors who live alone in Newton and have no family?
Sure. Dementia Friends is a national but also local here in Massachusetts program that offers a variety of free services and mostly trainings and programs about how to support people living with dementia, how to communicate with them. It can be taken by anyone, including, city workers and providers, but also family members. So you can be trained as a dementia friend. And I think it's been a pretty successful program with respect to just trying to change the conversation and reduce some of the stigma and raise awareness of those programs. I know I did see someone earlier asking about the survey being for people who don't have computer access. And I will say that yes, we mailed it hard copy to people, and 53% of our respondents responded in paper, and the other 47% responded online. Just for.
Someone asks, as you know, country of origin is very different from race. I am concerned that the current people who use the center do not reflect the diversity of the city.
I think that there's agreement with that, so that,
Yeah.
I think that's one of the areas that needs to be addressed. And if you read, there is a section on that in the massive report.
Satya, there's someone behind your head there.
Oh, yes. You can say your question. I can repeat it into the microphone.
Yeah,
if
it's
it-
kind of hard, but
Oh.
it seems like there's services being put in the senior center.
Yep.
That is already existing, like fitness and
Mhm.
performance, and like there's YMCA's and other gyms. So like, how are you guys deciding what physically goes in there
Mhm.
versus what you're kind of connecting to people? Because that's like a small
Right.
space.
Yep.
So how are you dealing with that?
Yeah, absolutely. I think one thing that's wonderful and challenging about Newton is that there's so much great stuff going on. There's a lot of great fitness programs all over the city. There's a lot of great social service agencies all over the city. And we all need to know each other better. And there are some networks doing that, but I would implore people that if you are involved in one of those services or those fitness programs or other programs that service older adults in the city, reach out. Let's have a conversation. Let's all talk together. We should work together to try to offer as many different things as we can for folks and at as many different times or venues, so that we're not all trying to do the same thing. Our goal is to connect people with as much connection as they want, and that doesn't all have to be done by us. We want to be able to connect to those outside resources as well.
Are there going to be other departments housed at the Cooper Center?
So the older adult services will be housed at the Cooper Center. Recreation, Parks and Culture will be doing tons of programs at the Cooper Center.
Okay.
The Elder Affairs Officer for the city, Eric Rosenbaum, will have office hours and be on site for some of the time, which we're looking forward to having him nearby. He's a great partner. We'll work with, we have conversations with the library, we have conversations with Health and Human Services to see how we can collaborate and what kind of situation and things we can add.
We had another good question from a participant on Zoom. I was surprised that in programs, we'd like that assistance with technology didn't appear. Was it mentioned somewhere? Thank you. I can answer that. Also, the Cooper Center, we have a tech tutor program that you can apply. You can send your information in, as well as a question that you have that you need help with. And we have volunteers who connect with our participants who are asking for technology assistance. The Newton Free Library also has a tech time that anyone can sign up for, and it's, I believe, half an hour once or twice a week. You
Oh, yeah.
check the calendar for the Newton Free Library.
Yeah. Right, and we did ask a series of questions about people's comfort level with how confident they feel about the following activities: finding information online, submitting information or making applications online, purchasing, managing money online. So we asked about various things that you can do online and whether people felt comfortable with that. And the places where I think people had the most sort of opportunity for learning was about staying safe online and how to protect their personal information. As well as online and virtual doctor's appointments, sort of managing accessing healthcare through virtual platforms were places where people were interested in some support.
I did have a conversation, one of the conversations in a focus group was somebody who said that I don't want to really learn about computers. I already know about that. I want to learn about artificial intelligence. So
Yeah,
I
there you go.
want programs like that.
Yeah.
Another question, when will the center open?
$1 million question. Fall of 2025 is the best estimate they'll give us. Batya, is there more questions or should we wrap up? And I'm happy to stay here, and I don't know if the ladies can
Yeah.
stay for a few minutes. So
Yes.
please feel free to come up and ask additional questions if you have them. And if you think of others at a different time, we're happy to speak with you. And thank you so much for coming out this evening, and we hope it was